oxygen service was originally set up approximately 8 years ago. One of the important things that we realised quite quickly that oxygen wasn't just about giving patients clinical benefits. It's become quite clear as the service has developed that there are incidents where patients unfortunately have sustained serious injuries or burns, or their property is caught alight due to smoking with or near their oxygen therapy. With the support from my organisation, City Healthcare Partnership, and my team, we actually did develop a safety film. We worked very, very closely with the Humberside Fire and Rescue team, and that development of the DVD has been quite integral in how we manage patients that are at risk of injury. The oxygen service, particularly with development of the safety film, has had a huge impact not just on the patients and safety, but also on making sure that the message is sent to these patients in a cohesive and workable way. We get a very high patient satisfaction result. We do have a comprehensive service which we go to the patient's home. We make sure that we give the right provision for the right patient in a safe way, and that's what we pride ourselves on, really.
I was on the nursing course at York. We had the option to transfer to do a 4th year, which was Masters of Nursing, and as part of that course we did an 18-month internship. So the service I was working for was Scarborough CAMS. The project I did was about seeing if we could make the CAMS service more accessible and more appropriate to the needs of the young people and children. They were finding it quite hard because we were open 9 to 5, and obviously most of them were at school 9 till 3, so to come to appointments means that most of the time, unless they get that very priced 4 till 5 slot, they're going to be coming in and out of school, and they'd have to get their parents to take time off work. They were worrying about, well, what am I going to say to the teacher? People saying, so where are you going every Tuesday afternoon then? Maybe they don't want everyone to know they're going to CAMS. And it made sense when we thought about it. Hang on, why are we doing a service for children which runs at the same time as school where we want them to be? Over the period of 10 weeks, we opened late on a Tuesday night. As we expected, everyone who came to the evening clinics said, if you were to offer evening clinics again, we definitely want them. At that point, the service didn't have the capacity to extend opening hours, but they knew that there was a demand, and that's something that they could look at in the future.
I've been involved in mental health most of my adult life, really, in a personal way, in as much as I've had serious mental health problems throughout my life and still live with them now. In a professional context, I've been working at the university for around 12 years now, and throughout that period, and in my work with the NHS and in my role as a director of a charity, I've developed quite a large number of projects really around broad themes in mental health to really understand what might help folk who live with long-term mental health problems. One needs to listen to and learn from patient voices, the voices of service users. I've done lots of different work with the NHS. I currently chair the Service User Engagement Group and have currently put together the new strategy for service user engagement for the NHS Trust in Sheffield. And I'm really proud that that strategy has been developed on the basis of many, many conversations with people with lived experience, as well as conversations with staff at all levels. The strategy is bold, it's ambitious. I think it's an exciting strategy. I'm not sure you can often say that. So while I may have done most of the writing of it, actually it has drawn on the insight and knowledge of many other folk who, like me, live with mental health problems.